Hi, my name is Cheryl Cohen, and I'm one of the consumer reporters for the Arthritis Broadcast Network. I'm joined here by my colleagues in the consumer world at this year's Canadian Rheumatology Association annual scientific meeting being held in beautiful British Columbia, Whistler, BC, where it's blue sky and lots of snow in the mountains. We're really thrilled to have today with us Dr. Carter Thorne, who is the outgoing president of the Canadian Rheumatology Association, as well as the program director for the Arthritis program in Newmarket, Ontario. So he's both provided leadership, fearless leadership over the last 2 years for his colleagues in rheumatology, as well as been a long-standing leader in the clinical practice community. So thank you for joining us, Carter. We're really, may I call you Carter?
Absolutely,
okay.
Cheryl. May I call you Cheryl?
Yes, you may. We're really happy to have you here visiting with us, and we just have a couple of questions for you about...
Just to make, first make a comment about how important it is to have patients at these meetings. They make such a difference, and we're certainly trying to take advantage of the knowledge and experience and the passion that patients have, people who have arthritis have. It really energizes most of our members because we see our people who have arthritis oftentimes just in the business, as I can say.
Yeah.
And now we're seeing the human side of it, and the presentation this afternoon by Kathy Hofstetter was spectacular.
Yeah, we just interviewed Kathy just before you, and I couldn't agree with you more. And I think the Canadian Rheumatology Association has really, there's been a sea change in its, in opening up its arms as an association and allowing consumer leadership from Canada to really be better integrated into the things that happen at this meeting. So we're both thankful, and we agree with you. We agree we're an important part of the dialogue. So thank you so much for that. I have two questions for you. One, as the outgoing president, take a look 2 years behind you and tell us, if you can, sort of 2 or 3 things that you felt were real advances for your profession. I know, obviously I know you, Carter, well, both professionally and personally, and I know you're always in it for your patients. But if you think about your community of rheumatologists, what do you think you've accomplished over the last 2 years for your profession? Yeah,
for the profession, in terms of the organization, what we've done, and my goal 2 years ago was to make sure that we had a foundation that would allow it to go forward, both from the financial support aspect, but also for the mission. And having appropriate infrastructure. So I also brought in a concept of convergence, and because we're a small community, it's important that we direct our efforts towards our mission, which is to improve the care of individuals with arthritis and advance research, advance education, such things as that. So in that part, we've tried to bring those various things together. So in access to medications, access to service, so models of care, as you know, I'm a big believer in that, models of care. I think that's in addition to the new advances in medication, some new advances in using the medication, and it's in the engagement of individuals who have arthritis. That's really made a difference. But sometimes if there's system problems that we confront. And oftentimes those are related to other bureaucracies. Can be ministries of health, Health Canada. And so we've made significant attempts to bring together or to approach the issues. So for our First Nations patients, for instance, our members told us that there was quite an unevenness in access across the country, which I was very surprised about because I see them as one peoples. And so we worked with the NIHB to try and improve that, and we've had some success. It's taken a while, but we've had success. The last meeting was
good things come slowly sometimes.
Yes, it's never lucky. It's always planned. And so it's that kind of activity. So we see the next significant hurdle. And again, there's nothing in it for the physician here. It's about improving the access for our patients in a timely fashion. Big burden, these are the new approaches to care, and working with the private payers to ensure that they don't put up new barriers that we haven't experienced in our Canadian environment, but we see as a potential significant issue.
I think we share that concern at the sort of arthritis consumer sort of level, because one, we experience it every day, as I think it's about over 50% of our population is actually covered by a private formulary, not a public reimbursement system. So I want you to know that our consumer organizations that are aligned and supporting your mission and vision want to tell you that we have found your leadership very inspiring, that you probably more than any other president before you has been so willing to include our perspective in the actual formal proceedings of your meeting. And you've also brought advocacy. You've really ramped up the activities around advocacy in your association. That's very evident to those of us who volunteer and work in the community.
Well, in the practice of rheumatology in Newmarket, I've seen the value of bringing people of arthritis into the care.
Yeah.
So as you know, we have ambassadors to care. It is part of our program to help the individuals who are new to the illness, to help them explain what they're going through from their personal experience. And that message of hope that they've been able to bring has really transformed so many people, which is difficult to do from the pure clinical position. And without that partnership, it's a much tougher battle. So we're taking advantage of what we've learned has been so essential, which is patient hope.
And you have, from a professional association perspective, you have that moral authority to make those arguments or try to persuade, as we like to say in our own shop, to persuade for appropriate new policy or appropriate reform of policy that doesn't quite work all that well.
And I certainly agree with you. What we try and do is not only talk the talk, but walk that walk. You know, we don't tell. I don't advocate anything that we haven't either demonstrated in a statistical research fashion, because as you know, I'm quite interested in research, but real world research. What really makes a difference to our patients, but also about sharing that information, because I think that healthcare is something that moves slowly forward, but then all of a sudden the light bulb goes off, the epiphany happens, and then we can make another leap. And that's what we're looking for. We're looking for those epiphanal moments and sharing that as best as we can. And patient participation in our real-world cohorts, like CATCH and like the Ontario Best Practice Research Initiative, allows us to develop the ability to identify those best practices and then hopefully be able to implement them across the border, because it's my belief that my members are really interested in doing the best they can for patients. But the challenge is that there's not often a mirror on which to review and view their successes.
Well, on behalf of 4.6 million Canadians, I want to take this opportunity to thank you so much for providing such great leadership for the Canadian Rheumatology Association. I think the incoming president, Dr. Corey Bailey, is being handed something in quite good shape, and I know he also is a great leader and one of the younger members, actually, of the association. So it'll be interesting to see what kind of imprint he leaves on the legacy of the CRA. But you've left one that is shiny and bright. So thank you very, very much.
Thank you for the kind words. And I'll be changing roles, but not my obligations to my patients.
Of course. Thank you.
Thank you very much.